Um, Good. So we looked at the X-ray, and I didn't really see any real big problem on your X-ray. There's no heel spur, and even if you did have a heel spur, the heel spur isn't the problem.
Okay.
You have pain when I push on the bottom of your heel, right there, right?
Yep. Yeah, it
So
hurts.
what I usually do, Troy, is I show people. Do you want to see the presentation I actually go through when I show this to people?
Yeah, definitely. Yeah, yeah,
Okay,
absolutely.
I'm
Yep.
going to share my screen here with you.
Yep.
So I have this thing called. Can you see my screen, Troy?
Yep.
Okay,
Achilles
so
tendon.
this is called my patient presentation tool. So everything that I treat is right here.
Hmm.
And I'm also going to email you a copy after I see you with a little video of this. Actually, my scribe is going to do that for you.
Okay.
So this is the condition that you have. It's called plantar fasciitis. You have pain on the bottom of the heel right here every time you
Yep.
stand up. And like you said, it's been hurting you for a couple of weeks. You're not really getting better. You've tried some ice, you've tried some heat, you've tried some stretching with your little massage tool. Anything else that you've tried?
No, that's about it.
Okay. And it impacts your life because it sounds like it's hard to get out of the chair. It's just uncomfortable. And you're worried because
Sure.
it's not
Haven't
getting
been able
better.
to
Yeah.
run, go to the gym, nothing like that. Yeah.
So that's why we want treatment now. So let's just explain a little bit about the plantar fascia because people really aren't used to this word. Plantar just means on the bottom of the foot, and fascia is this little white thing. So if you look, there's a little ligament that goes from the heel to the ball of the foot, and this is like a ligament very similar to the Achilles tendon, and it's white. So if you look at the color, white thing. Do you think white things, Troy, have good blood flow or poor blood flow? Any
I
idea?
think it would have poor blood flow, I'd imagine, wouldn't it?
Yeah, yeah, you're right. So stuff that has good blood flow would be red. Like muscle
Red.
tends to
Yeah.
be red. You never hear of anyone getting a muscleitis because muscles
Right.
just they have a lot of good blood flow. You hear people many times getting a tendonitis because it's white or a fasciitis because it's white. So
Right.
most of our
Yep.
focus is going to be on trying to reduce this inflammation that you're having in the fascia. And we have to get
Hmm.
more blood flow. So many times when things don't get better after a certain period of time, it's only been 2 or 3 weeks, so it hasn't been that long. But I find if it's been over 6 weeks, it takes something that's more of a recent problem, an acute injury, or we call it makes it more chronic. Okay.
Sure.
So a big culprit though of this heel pain is tightness in the back of the calf. Because if your calf is tight right here, it pulls on the Achilles, which then also pulls, they kind of play tug of war on the bottom of the heel. What happens over time, though, is the fascia itself becomes thickened. So, this is an example of a normal fascia. This is an example of a fascia that's very thick. If something doesn't heal, it changes from this to this, and this can happen in about 6 weeks. So, my thought is we're going to start some treatments today. And then when I see you back in about 3 weeks, if things aren't getting better, we're going to be doing an ultrasound to take a look at the bottom of the heel.
Okay.
And that looks something like this. We'll do that at the next visit. In your case, you do not have a heel spur, but even if you do have a heel spur, the spur isn't the problem. Back in the day, people always said, "Oh, you have a heel spur, that's the whole problem." It's really not the heel spur that's the problem at all. And I put together this little treatment plan here. It's called a plantar fasciitis treatment evaluator, and I find this kind of like simplifies the process because I think there's a lot of information out there when people are looking up plantar fasciitis. I think that there are certain treatments that are most effective, other treatments that are least effective. Okay, and then you have to work on a couple of components. I always say we have to work on one component in each category. So you have to help reduce the pain because you're in pain. The tightness component is something that people really aren't aware of, but I think tightness has a lot to do with it in the back of the calf. And I find that for many patients, just treating this tightness can take away a lot of the pain. And then you want to reduce the stress going through the fascia. And what the research has shown is that the higher the contouring to the foot, especially to the plantar fascia, the more stress it takes off of it. So if you can make something really high to your arch, it's going to take pressure off of that. Troy, I'm going to go over the treatments for the first visit. So usually the first visit, I'm going to give you a prescription anti-inflammatory. And just so you know, I have a little thing in my pocket. It's
Mhm.
called a treatment checklist, and I actually fill this out with the patient. Okay.
Okay.
I circle what we're going to do. So I'm going to circle. I took check X-ray because we did that today. I'm going to circle ultrasound because we're going to do that next visit. And I'm going to give you I'm going to start with some basics because you really haven't done the basic treatments yet. So I'm going to start with an anti-inflammatory, and I'm going to have you do contrast baths. So contrast baths are just 2 buckets of water, one that has hot water and one that has cold water. You go 5 minutes in the ice water, 5 minutes in the hot, and 5 minutes in the ice. And then if that's not better, at the next visit, we'll do the ultrasound, and the ultrasound is what will help me to determine if we're going to do the shockwave therapy or if we're going to do a cortisone injection. I don't do as many cortisones anymore because I think it's short-lived. Okay.
Okay.
Any questions about that
No, how
portion?
much is it going to cost me?
So this is all covered by insurance. Anti-inflammatories is covered. Icing, you can just get a
Okay.
bucket of ice. So that's free.
Yeah. Okay.
Uh, and then the next aspect is I'm going to do a night splint or a home splint that's going to stretch your foot. I have a little protocol here. So usually one is you do a towel stretch before you get out of bed in the morning. Number two, you wear some UFO sandals. You can get those at a local sneaker store. That it's a really high contouring sandal. Then I have you wear a splint called a night splint for about 3 hours, and that's to stretch things. And then foam rolling. So you asked about price. The foam roller is like $35, but the night splint's
Okay.
covered by your insurance. So we're going to do
Okay.
this today. You're going to do that for the next 2 weeks, and then
Yep.
finally, I already recommended the home sandal. I would recommend getting a newer shoe and not going barefoot at home. So either wearing the UFO sandal that I'm recommending, or wearing an appropriate shoe at home to offload the area of the fascia. I would start with that. So that's usually visit one, Troy. Then they
Hmm.
go home. Most of this stuff is covered. My staff gets them the night splint, teaches them foam rolling, gets them the things like that. And usually at the second visit is where I present the orthotics. So I can go
Okay.
into the second visit if you want, because I think
Yeah.
there's a
Okay. So
there's a need to believe. Like patients need to believe me. They need to find some improvement, right?
yeah.
And that's why I don't do it the first visit. I think it's a big ask for the first
Sure.
visit.
Yeah. Okay. So a couple. First of all, I like your presentation is good. I love the whole. Um, none of this is concerning. A couple of things that you did is without you realizing it, you're very dominating when you communicate, Donald. Very dominating when you do it, right? Um, you closed too soon without you even realizing it. The treatment side when you got so now now with two things, right? If these are existing clients, they already kind of know your nature. So let me ask the question: how are they existing clients? If I've come in like that, there, I'm a new
You're
client,
not
right?
you're not an existing. You're a new patient usually.
Okay, that's what I mean. Okay, so there's two different things, right? So I'm gonna share a slide with you now as well. I'm gonna show you exactly what I'm talking about here.
And one thing maybe I need more time because I usually have about 20 minutes with patients, 15 to 20 minutes.
Yeah, yeah.
So I'm just letting you know. And so in or I feel like I'm a nice guy, but maybe I should talk less. And I usually do a pretty good talk before and asking them questions, but then I go into the
Right.
presentation. But if you have some suggestions, I want to hear it,
Yeah,
please.
no, yeah, no, yeah, that's what we do. We're gonna kind of, so straight away, first of all, based on what you said at the look, we're gonna be able to increase your conversion rates, but I want you to do that exercise. We haven't gone, but even for you, I want you to get in your own space, not now, but I want you to get in your own space. Think, why would someone buy? 10 reasons, and 10 reasons why someone won't buy. And the reason why we want to do this, Donald, is I want you, yeah, I call it becoming your own director of your presentation, right? So I want you to think about when a movie gets made. You got director, he's putting a movie together and he's thinking, okay, how does he want the scene to go? What reaction does he want his audience to think and feel? And then how is he going to get the actor to play that part? So at all times, they're in the mindset of the audience, the actor, and to get that specific emotional element. I want you to start feeling that way. How do we do that? I want you on your own. I don't want you to do it with your partners. I want you to do these things separately for a reason, because this is like a transfer of your mindset. At the moment, when you're talking from your perspective, not so much the client's perspective of empathy. And we're going to be doing that, right? So if you do that exercise, and the reason why we do 10 is you're probably going to come up with 3, 4 very easily, and you're going to struggle with the next 5. And Donald, why this is so important is if you can think of reasons why someone wouldn't buy, and I know you're putting everything on price at the moment. Um, again, yes, I'll be hearing your section, meeting two, but we're just focused on meeting one at the moment, right? So meeting one, there's not that much investment going forward. But the reason why I said close too soon is please can you see the PowerPoint screen
Yep.
on your screen? Yep. Okay. So when I said anyone would say don't stop acting like a salesperson, one, you build rapport, friendship, trust. Yes, because no one wants to do business where they don't trust or like or they don't have rapport with it. So rapport, friendship, trust, that leads to commonality and credibility. And in your business, that's vital, right? So rapport, friendship, trust leads to credibility, commonality. And commonality is like, you know something, John, don't worry. A lot of my patients have come in with that same thing. You don't have to worry about it. Okay, you don't have to worry about that. And I'm going to give you and one thing when I talk, Donald, I don't always talk about specific about your product because I deal with people globally, right? And so you're going to see, I'm going to talk in three different ways. One, I'm going to say something directly, Dom. I'm going to give you an example of it. I might even relate it to a movie or something that you can be done going forward. But I'm going to give you an example of what I experienced. I've got a skin specialist, etc. And I went through and I had a rash just before New Year. And for the last 5 weeks, I've kind of had this, and the specialist gave me the all clear. But this is what he did. I went in there going for it. I wanted him to say, look, it's nothing to worry about. And this guy's got zero empathy. He's one of the best here in Cambodia, non Pen. He's got zero empathy. So what he does, he gets it, he gets all these things out, looking at it, he puts it on the big monitor, and I'm just sitting there and I'm just like, what's going on? And he's going through and he's picking up the pen. And all I want him to do is tell me it's nothing serious to worry about, Troy. That's what we want to hear, right? When we got something, on our skin, we don't know what it is. We kind of want that. And because he's got no empathy and he can't even get into my thought process, I'm I'm like, my God, I'm going through a heart attack. Is it serious? Is it this? Is it this? And he's not even giving me anything. And then I say, is it serious? He goes, well, yes, it could be. Now, I'm not wanting to hear that, right? I'm not wanting to hear, yes, it could be, but that goes, oh, okay, done. But I went to 6 months ago about something very trivial, and he was like, done. He's getting the pad out. I said, is it serious? Oh, no, it's nothing to worry about. I was like, and I kind of got angry at it. It was the first time I went to him. I said, look, you've really got to learn some empathy because you have no idea how to communicate with a client. For 10 minutes, you've been looking at, and he got up there doing this. And I'm like going, is it serious? Is it cancer? Is it this? And then you tell me, oh, no, nothing to worry about. Tell me earlier. Tell me earlier this thing. Because so and I think doctors don't do this enough. They really don't. They kind of need to get,
Because like
customer service
90% of my
communicated.
patients get better. It's just a matter of how much treatment they're going to need. So it's going to get better.
No, no, yeah. But again, see, you're saying that from your perspective, not the client's perspective going forward, right? So when you get MRI and stuff, we don't know. Like, I'll give you a classic example. There's a movie. It's like his greatest quarterback of some of the movie, and a guy gets in. He's got he's a football player. He's got a shin injury, and it doesn't heal. Go to a doctor, doesn't heal, right? And it turned out he had bone cancer. In 12 months, he was dead, right? Based on a true story, yeah. And but the guy, we don't know that. We don't know what to look for these signs. Now, I'm not saying that to you. I'm doing an overview of doctors here in general, because again, I've got clients who are doctor specialists and things like that. And one thing I keep saying to them is you've got to get in your mindset of your patient when they come through. They have no idea. And if it's skin, they're going to be thinking, is it cancer? Is it cancer? If it's an injury, they want to go, it's an injury. Do I need an operation? Is it serious? They want to kind of get the answer as soon as possible. And one thing what doctors do, they go in there so focused so much on doing their job properly, but they don't empathize with what the client is feeling.
So
It's like we get the plane,
what's
we
a
hit
suggestion
turbulence.
to what's
Oh
a
yeah,
way to empathize?
so Don, we're gonna So I'm gonna talk conceptually so you understand, right? So I'm not going to tell you because also there's different clients' profiles as well. So I've already worked out in a short period of time what your profile is. So I'm gonna coach you and communicate with you based on how you're going to take in information and learn the quick, right? So I know you're after a quick as we go through, you're going to learn more. Before we go today, you're going to have the answer. Don't worry about that, right? But I just kind of get to you from conceptually, because when you talk to me, you're talking as a doctor, but you're not really I didn't feel much empathy from what you do, and you were trying to show empathy. So you're trying to show me by explaining it to me. But also we want to go deeper. I want you to remember these words. Everything's recorded, so you don't have to write it down. Logic unlocks the mind. Emotion unlocks the wallet. Meaning something could be logically make sense, yes, but we don't actually buy it or act on it until we get an emotional feeling towards it. Does that make sense? Yeah.
Yep.
But in life coaching, our emotion controls our logic. That's why we have road rage and all the other things that can happen in our life. You know what I mean? Yeah, we react. Yeah.
Hmm.
But from a business perspective, logic unlocks the mind, emotion unlocks the wallet. When you're talking to someone, you want to kind of get, and so this is what I want to show you if you have a look here. This is the sales process. Also, one thing, Donald, you're not going to see any of this regurgitated on YouTube or anything like that. I've sent you one thing I did, David. I sent you my personal. I sent you my website link, didn't I? I'll do this very quickly.
I think I looked at it. I found it. I have a link.
You gave it to you. Okay, right. Yeah. Okay. Sure. Okay. The reason being is that so everything you see is not regurgitated. It's been created by me, set in call centers globally around the world, etc. So, and this is the best way of what a client feels through the process. So when you first come in, they've got their guard up, and like your business, even though it's a foot, even like you said, well, it's a foot, we can really heal them. That's because you know that. Most people don't know that. If I'm a runner and I come into you, I don't know, my career could have been done if I get done. If I stood up and my foot, how serious it is, I have no idea. So as you go through the process here, you can see the guards coming down as you're building trust. Now, when you've got a new client, your client's already here. You're already the authoritative element. They already trust you because you've been able to help them in the past. And now you're just kind of showing them, okay, how you can fix their solution with their pain. So when I look at your presentation, when I look at your presentation, you do this really well. Okay, you do this really well. When I said to you about you closed too soon, you were telling me things that said, yeah, and I'm going to do this for it, I'm going to do this, I'm going to do that. And so if you got someone like a driver personality, someone like Donald Trump or something, which is he's never wrong, he's very direct. If you said to him, oh, we got that, he might say, yeah, well, I don't know, I haven't made up my mind yet. Yeah. So because you're telling them to do something and they may not want to do it. So I'm just going to show you how to deal with it. For example, you could say, so John, this is kind of what I feel where the problem is at. Please have a look here. And you did that well. I loved how you showed the PowerPoint slide. It was brilliant. You did you're going forward here. And so, John, this is what a lot of patients of mine has dealing with, like this here. And based on this symptom, I think you're kind of suffering from the same thing. Now I'm not fully sure at the moment, right? So what I would suggest is we could actually do this and this and this, right? Yeah. And the reason why I'm recommending this is because of this and this and this reason. So do you see what I'm doing? I'm actually taking it step by step. And the reason why this is so important is this sets up the foundation for you to be able to close me on the $600 product in meeting 2, because you're educating the client on why you're suggesting that, right? So, for example, if you go to a doctor and you've got a pain here, he can talk to it and say, well, okay, I think we need an X-ray, this. I don't think it's anything serious, but we just want to make sure, right? Let's get some blood tests. We go, okay. But so, yeah, and I want you to elevate your business because you're on the same level as a heart surgeon. And you don't realize that in a client's eyes. And why am I saying that? Because if I've got something wrong with my heart, yes, I need to a heart surgeon, right? If I've got something on my foot, I go to heart surgeon and say, what are you talking about? I don't deal with that. You're on the same level, except it's just a different part of the anatomy of the foot, but you're on the same level. People have the same fears, same thing. If I'm a runner, and my heart is good and all of that, but I can't get out of bed in the pain going forward, that's just as scary for me as if, hey, I got a pain in the heart area. What's the difference? There's no difference with it because I don't know any different. Right, going forward. Now, the reason why I gave you an example, and one thing too, Donald, you'll hear I never say anything without a reason, ever, okay? And so the reason I gave you the example of the the movie with the football where he got bone cancer on his leg. I saw that movie, right? So I go in, I put my foot on it and go, heck, and I'm looking and I'm pushing going forward, or I got an injury. Now, that's why if you've got a problem, never go on Google and say, what is it? Because they're going to say you got cancer and cancer. But I don't know what that is. But I've seen a movie and some guy he had just a sore leg, right? And it should have healed. Now I've got this. Now, it could be 1,000,000 to 1, but I don't know. And that's why I'm coming to you. So I want you, one, to elevate your self to a level of a heart surgeon because you're on the same level, except it's just a different anatomy of part of the body, but you are in someone's eyes. So once you do that, so when you go, oh, well, 90, well, I fix everybody, your patient, and especially anyone, don't know that. So they're wanting that reinforcement. So that's why when you have a look here at the process, when you build rapport, trust, and you show the need. Now, showing the need is a classic example of saying, well, John, I've had patients with it. I wouldn't, it's nothing to really worry about, but, the best thing is that it's only had it for 2 weeks, which is kind of good, right? So this is kind of, I want to take this treatment first and then try it for a week or two and see, and this is what I expect could happen, etc. Now, if it doesn't, well, then what I think would be a good idea is, we might have to dig a little bit deeper and then we could kind of get an ultrasound. But again, clients come to me now. I don't think it's anything to worry about. So do you see what I'm able to do now? You're educating the person that you're going to make me feel safe and secure. And I'm going to give you the easiest example because we've all been there. We've ever been on a plane and we're hitting bad turbulence, right? Yeah. Part of us, and it's really shaking, part of us, we want the captain to get on to say something. We don't want him to be quiet, right? We want him to get done, and we want to hear a really calm voice who says, oh, this is the captain speaking. We're about to hit some turbulence. Yeah, going forward. We expect to get out of this in about 5 minutes. We're going to go to like 30,000 feet now. And I expect, so yeah, a bit bumpy ride, but we'll be out of it soon. We want to hear that, correct? Yep. Until we hear that, we're thinking the plane, some people will exaggerate a point, and I'm exaggerating a point to prove a point. Oh, what's happened? The plane could be shaking, etc. We don't want that silence. We want that reinforcement. And so that is why when someone has a problem, you're wanting to say, yeah, I don't think it's too much, but a lot of other patients have had that. So that's why when I said, I wrote down here actually, close too soon, because you said, we're going to do this, 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 this. And the first thing when you said that was like, oh, hang on, no, I'm doing something I don't know why going forward. And so I just kind of want you to be mindful of that because this sets the tone for meeting 2 when you're going to say, hey, I'm recommending, and that's what number 4, number 5 is, you become the authority. So remember I said you want to be a salesperson, stop acting like a salesperson, build rapport, friendship, trust, leads to credibility, commonality. Number 2, you become the client's confidant. I'm sure you got someone, Donald, you got partners that you confide in and you talk to them and stuff like that there, right? Yeah. Think about the amount of trust that you have for that person, right? For you to confide into them, right? Yeah. So you want the client and your patient, so you want your patient to confide into you and start telling you what's really worrying them, right? You want to become confident. Number 3 is you want to become their advisor. Why? Because we know someone doesn't want to be sold anything. We already know that, right? So we want to become the advisor. They confide in us, that's my problem, and then we want you to advise me what is the best solution. So if you have a look at here, number 5, we got become the authority, tailor, suggest solutions to them. And this is something I get all my doctors, patient specialists in the medical profession to go, don't tell me what is the problem. Show me a comparison that I've got a problem and other patients have got it as well. I don't want to feel like I'm subject to the rule. I want to feel, because when you show me other patients, oh, okay, then we'll good. I'm just like them. It's not that serious. And then you don't say, yeah, and some doctors get away with it more than other professions. They really do, where they'll go, okay, well, you need an X-ray going forward. And then you want to suggest a solution. So in you could suggest this, knowing full well, I'm going to follow it because you're the authoritative element. I'm listening to you. And then, so you can use number 5 here, and then you use number 6, which is, by the way, John, tried it for 2 weeks, for a period of time, and then you can start implementing your $600 product. by saying, also, I think this is going to prevent you having it in the future. Is helping you, Donald?
Yeah, it sounds like positioning for the next visit, the same way I position the ultrasound for the
Yes,
next
yeah,
visit.
yeah, yeah,
I can
yeah, yeah, yeah.
position
So
that.
two things. Yeah, so you're not only positioning to, but so when you come into the second, the patient comes in for the second visit, you're not going to be a stranger to him anymore. It's going to be like an existing patient you've got, right? You've already got that credibility going forward, so you don't have to go overboard to try to create that go into the heavy depth of building the trust. They've already got that for you. So they're more than likely to follow your advice. So that makes sense. They're going to follow your advice going forward. I'm going to show you how to present the product because you're already doing that well. So this is why this is really important. And if I said to you at the moment, I'm going to ask you an interesting question. It's not a catch you kind of question. But what do you think you sell? What service do you actually offer? Think
Confidence.
about it. So I know you're going to say I've said it, but I'm asking it for a reason. I want you to give me
Confidence.
another answer that you haven't given me. What service do you really offer? The main service you offer.
Um, I think the main service is I'm selling them confidence in a better future for themselves.
Okay, right. So that you're on the track. Yes. So yeah, because that's it. So, but what you're really doing is they're not in pain. You give them better quality of life, better quality of life. Okay, and that's what you do. And when you do that, and thought that I got a client they do mouth guard, and they were like, oh, they're trying to sell the feature of the product. I said, no, that's not what you're doing. People are grinding their teeth at night. They're having pain. They're having this. You're selling better quality of life. So, I want you to use some of that words as well, Donald. John, I don't think it's done, but the thing is that in 6 weeks' time, you're going to be in more pain, and you can't go running, you can't go jogging. How does that make you feel, John? And I want you to ask questions. Someone says they'll go running a lot, go to the gym. John, how does it make you feel? You can't get to the gym. Yeah. Again, logic unlocked the mind. So everything you're saying now, logically, it makes sense. But if you're going to hit me with $600, you're not going to get my money because there's not an emotional element to it. So but for you, it's perfect because, you've done a great job. I don't give false praise. Okay. So when I say something, it's real. What you really did, is I love the way you structured it. I love the way you kind of showed me the muscle group going forward because you're educating me, right? You're educating me. So if you got talking to someone with an analytical mindset, so you've got the four quadrants. You've got driver personality, expressive, amiable, and analytical. So if you're talking to someone like a driver, again, this is not political because I'm Australian, I don't care. But yeah, get someone like Donald Trump, for them. He talks direct, and you could never tell him he does something wrong, right? He won't accept that. So you've got to communicate with him very differently than someone who's an expressive personality or someone who's an amiable, where you go, yeah, yeah. So yeah, I think this could help you. And they go, okay. Have you ever had someone do that, Don? They go, okay, yeah, okay, okay. And then you show them, but oh no, I don't want it yet. I need to think about that. Have you had people do that to you?
Mm-hmm.
Yep. So that could be an amiable type of personality. A driver personality will be very direct. Well, I just want to know what it is, how much. And I kind of did that a little bit with you and I wanted to hear how you did. I said, how much is it? I loved what you did. And what I love about the first one is there's no cost. And again, you did a great job. I said, oh, it's only $35 and everything's covered by Medicare. I loved how you did that. So I took a cost up. I tried to be a driver. Okay, no cost involved. But this is the thing why I said you closed too soon. And I went, um, do the consult, put the treatment slide first before saying the words, and this is what we're going to do, the treatment slide. Show them about the different pain elements. Again, that was put that slide straight in before saying, and for the visit, we're going to do this, we're going to do that. Put that treatment slide in because what you don't want to do is, and the way it's structured, and I can see why people are not buying a $600 one because I'm going into the first one, it's free, 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 free. Yeah. And I know you're doing that deliberately, but now I come in for the second one and then I get hit with a $600.
Or it's more than that because the Shockwave, which I have no problem selling, is $1,500, right, for the six Shockwave sessions. and then the
Okay.
orthotics are 600 on top of that.
Right. Okay. So you see what I'm doing? That's what you did to me in the second meeting. Free, 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 and then just slap me in the face on the second meeting. I'm not expecting that. Right.
Should
And
I
so,
position it before? Should I introduce
yeah,
the price
absolutely. Yeah.
before?
Okay. So this is something,
Let me just go back, Troy. I just want to
hmm,
recap what you told me just to make sure I got
yep,
it.
sure.
From what I heard from you and what I saw, the way that you expressed yourself, I feel like I feel like I'm an empathetic person. I just feel
Yep.
like I'm an empathetic person that's in a rush. And so I'm very, even my wife tells me this. When I get in my zone of like
Yep.
treating, it's very like a machine like. And
Yep.
from what I understand what you told me, I think if I maybe just slow down a little bit and
Yes.
not maybe change what I say, but involve the patient a little bit more and just slow down and maybe, you know, get a little more buy-in. Hey, what do you think about this? How does this sound? Does that make sense? This is what we're going to try first. This is what, you're going to be fine. Things like that. That's what I understood. Really, I think it's
Yes.
slowing down.
Yeah.
Because I
Okay.
was just
So
going boom, 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 and you're going to still
sure.
accept it anyway, but it's just your perception of it.
Yeah, okay. So I'm going to this, and I'm going to show you this slide now because, yeah, yeah, I wrote that down. We're going to address that, but this is kind of what I want you to. I'm going to share a slide to you now here. Okay, okay. This is why. Okay, this is why I don't know why some people don't make sales. Okay, this is it. Um, they're selling the product first. Okay, so and don't take this is a no specific order. And we can go into more. So what I'm trying to do now, at the moment now, Don, just so you understand, I'm trying to do like a 360 overview of how to kind of get you start getting a better result coming tomorrow, right? And I haven't got you in a program as we're taking it step by step here. You understand what I mean? I'm trying to give you an overview to help you the best I can. And that's kind of why if you think it's like a little bit here, 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 it isn't. It's deliberately doing that so I can give you the most value in our time together. Now you know why I mentioned 90 minutes, right? We covered so much. But I'm not putting you in like, okay, we're taking step one, step two, step three yet. Does that make sense there? Right? Just so you can learn as much as you can during our time together. If we had another, if we have another session, we will go step by step for you to be able to get to where you want to be. Is that making sense there at the
Hmm.
moment? Yep. Okay. So this here is in no particular order because I haven't seen part two, which is really crucial because that's where you're trying to sell your high end. But here it is. But this is the reason why they sell the product first. They don't have that no rapport, no trust. I didn't. I felt that with you, but we want to take that to another level because
More
yeah,
spend more time with it, like more time.
yes, yeah, absolutely. This is most importantly with you. You had your own agenda and what you said about about going fast. So it's not just about you going fast and talking fast. It's not just about that. It goes a bit in depth. You had your own agenda of what you thought you needed to cover, right? Um, and you were like done, 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 and then you're going to get to the end of it, and then you ever play Donald? You ever play poker?
I like years ago. Okay, but yeah.
Yeah, that's okay. Okay, okay. The first thing if you play poker, they say if you don't know where you are in the hand, right, you fold because that's where you're going to lose money. If you don't think you got the best hand then or got an idea what your competition has, fold it because that's where you're going to lose your money. Even if you got pocket aces there and there's a king on the board and you think, hey, no, that he can't have that, you fold it if you don't know where you are. And the reason I'm saying that, Donald, is I want you not just to slow down, but don't have so much your agenda and start reading the situation with the client. Getting what's he thinking at this particular time? What's he thinking when I say, oh, you've had that down, and does this affect your life? Take a stop, take a pause, read the body language of the person you're talking, get an idea and a feel. That's why I've got all these monitors. So anytime I ask you a question, if you're blinking this, I've got a pretty good idea when you're kind of getting lost, or when I'm not saying you in general, right? Yeah, again, not just for you, but I know when my clients getting lost, or I ask them and they get confused, and I'll probably say, "Oh, does that make sense?" And I can see straight away, no. And so if I keep going on with my agenda, I'm going to leave them a little bit behind. That makes sense.
Yeah.
And I just showed you the sales process. If I don't follow it correctly and I don't cover it, then the client's mindset is going to be somewhere, and I'm not going to cover that particular step. And yeah, I've got another, we go to 12 steps, but we don't need to go there yet because we're focusing on the initial element. That's why I haven't gone to step 7, 8, 9. And so, but what I want you to not just so much slow down, but think about when you ask the question, what is the objective of that question? When you're going to tell me something, what is the objective? What do I want the client to feel and think at that particular time when I'm saying it, right? So that's what I went that had your own agenda. I'm not going to say you don't have no structure to your presentation. You have a good presentation. It needs to be a little bit refined in some way because it's and yeah, you do a good that you don't do death by PowerPoint. You don't do that at all. Again, you've got your we just need to slow it down, have some specific questions when you go through. A lot of what you did is you told me, so you sold the product first without you realizing. And the product was you're telling me what my pain is. You asked me a few questions going forward, but and even though did you notice when I did it, I did my best to, yeah, I had it for 2 weeks and 3 weeks, so you got that, yeah. And it's like, yeah, it was like you had 20 minutes there and you're trying to fit it all in. So you're trying to get me in, get me done, and get me out the door as soon as possible. And that's not what clients need to feel, especially again, the amount of time that you're putting in this. And you can say, well, hang on, I want to put as many clients as I can. Yeah, but that's not really what your business is at the moment with this one. Your business is to create the environment and everything like that to be able to get me feeling comfortable where you can actually say to me, okay, I now, because you're going to ask me $1,500 soon. That makes sense there, right? Yep. Yep. Is this making sense, Donald? Right?
It is. It is.
Okay.
I
Now
feel
I'm
like
going to show you something.
it's a blind. It
Yeah,
was a blind spot. I feel because
yeah,
it's
yeah,
working.
sure. Yeah.
I think it's. I want to improve it though. That's why I'm here.
Yeah,
So
that's okay. So I'm going to show you. I'm going to show you something now. And I want you. There's a specific again. There's a specific reason here. I want you to look at. I want you to imagine that you'll want to pick a lawyer. Are you going to pick category 1 or category 2?
2
Okay. What? You didn't hesitate, right? Why?
looks more professional.
Okay. It's the same guy, right?
Hmm.
Okay. You got two different personalities here. You'd think, correct?
Uh-huh.
Okay. Now, it's the same with if you went into your lawyer and he had a tie over his shoulder, right? Yeah. Your perception would quickly change of him as well, correct? Yeah.
Correct. Yep.
So the reason why I'm using this as a classic example is it doesn't take much to get the wrong impression of somebody. Yeah. And so when you're doing it, even though you know what you're doing as well, uh, you've told me it's free, it's free, it's free, $35. And then as soon as you hit me up with the price, and don't take this to heart what I'm going to say, because I haven't heard the second one right. Yep. But when you said, oh, $1,500, it feels a bit of a scam. Why? Because you set me up for a fall type of thing. I'm not expecting that. I'm expecting it might be a short bit, but then I want 1,500, and then you're going, well, this is just going to be an insert in a shoe. It's really hard again. And so one thing, I want to listen to number 2 of you, but probably not today so much again because I want to focus on this other area. But we can do number 2 again, up to you. But the reason why is that we need to show the value, and the value you can't. I think it's going to be hard to show the value in a foot insert for 50 for 800 or 650. I think it's going to be very hard to show the value with that. Okay, for someone, and this gets back to your agenda, right? I don't want you to kind of go, oh no, Troy, it's really worth this. No, logic. Yes, it logically to you it makes sense, but for someone to buy, I've got to find emotionally element. But if you kind of go, okay, this is what we're going to do 1 and 2 and 3 and 4. Now we can go into it advanced. So you could say simply as, you know, now, John, one thing we could do as well, there are other things to kind of prevent this in the future. But before we do that, John, how is this affecting your life, right? Because, we could come up with a solution. And I've had clients where they've come back into me in 2 months with the same problem. So this is why I said, what are you selling? You're selling pain management. That's really what you're selling. You're saying pain management for now and the future. That's what you're
Mhm.
doing. So that's kind of where the 600. Again, I'm going to relate that to the mouth guard, where, one thing was said to get the mouth guard going forward. And then what would happen is after, 1 or 2 month period, the person wouldn't have pain again. So they said, oh, well, we don't need to keep the mouth guard and can we get my, etc. And it was like, well, guess what? The mouth guard is not fixing the problem because you're still grinding your teeth. So when I got like 40 consultants and stuff like that there, and I said, so you're not selling a mouth guard, you're selling pain relief, but you've got to educate your client. As soon as you take the mouth guard out, guess what? You may not have pain. So, oh, I've had it for a week now, 2 hour day of pain. Of course not, because your teeth has had a break for a period of time. But as soon as that mouth guard goes out, guess what? In a month's time, you're going to have pain again. Effectively, you need to deal with mouth guard. And that's kind of what I think we can do to position yourself to pay for the high end. We're going, this can fix your problem now, but we want prevention in the future. And that's really where I think if we position you, and we need to do more in the first meeting to guarantee that as well. We need to be able to do more in the meeting to make them feel like, hey, I'm not just kind of getting dumped with this. This is not kind of, oh, you hit me up for 1,500. Why? And you didn't tell me. And that's what I think your clients could be feeling a little bit as well. Does that make sense?
Yeah, so I guess from what I hear you saying, it's better to maybe even bring up some of the more advanced things. There are some advanced things we could do. We're not going to do that right now. We're going to start with more of the simpler treatments here with you
Yeah.
today.
Okay. Yeah,
Do I bring up pricing? Like I always say certain things are
no.
covered by insurance, other things aren't covered by insurance. Yeah, but you have
Yeah.
to invest in your health, and we can talk about that later on.
Yeah. So one thing again, I kind of want you to your terms that we're going to do. No, we're not doing anything. You're just advising me on what is an option here,
Okay,
right?
so
You're coming in, I've got a plane, and you're going to show me my options available. And everything you're showing me in one is covered under insurance anyway. So I can get a false sense because I imagine the $600 is not covered by insurance, correct?
not usually, nor is
Not
the other
usually.
thing.
No, is the other one. Okay, right. So if we look at and I probably have to buy two, so I'm looking at $2,100, right?
No, the orthotics are a pair for 600 and the Shockwave. So 600 for a pair of the
Oh, sorry,
orthotics.
I thought you said the Shockwave is 1,500
The
or something.
Shockwave is 1500 and the orthotics are 600.
Yeah,
Yep.
yeah. Sorry, but that's 21. If I'm going to get one to get my foot, it's going to be about 2,100, possibly
Yeah.
investment I've got to do, right?
Yeah.
So
Yeah.
this meeting you're doing now is a $2,100 meeting, right? And
I never
so
thought of it that way.
yeah, yeah, no, that's why, but yeah, that's why we're meeting. So yeah, and the reason, I'm glad you actually said those words because you never thought of it that way. Now you understand why I got that exercise, 10 reasons why to buy and 10 reasons why not to buy. Because what it's going to do, Donald, it's going to um I'm going to use this word lightly, but it kind of reprograms your mindset. As soon as you talk to someone, you're going to quickly get into their thought process, but not mine, not yours. That makes sense.
Mhm.
So again, with myself,
So I want to go back and
yeah.
correct my wording. So I normally say what we're going to do is this. What's a better
Mm.
word that I can use?
Well,
This is what I
okay, so
recommend for you, or
yeah, okay, so but you're not even kind of doing that. You don't need to because you're the authoritative element, right? So you're going to show them going forward, and then you're going to stop your slide. You can see like what I've done, right? I only show slide when I want you to focus on something and I'm talking about something. Otherwise, you can see that you and me can see each other very easily, right? We're not small, tiny, right? And I'm doing that for a reason because we want them to focus on what you want them to focus on. I'm going to show this to you now, and this is what I really want what we're going to do, right? When you and have a look at this, when we're looking at the power we have as salespeople, and everyone in you're a salesperson, everyone's a salesperson. When we go the power we have, what we want to do is we want have the ability to create a perfect atmosphere, and we want to make our clients feel comfortable, relaxed, and eager to hear everything you have to say. And that is what your presentation is. You want the client to kind of go, first of all, they're worried. You want to take that a little bit. Then you want to, I don't think it's too much worry, but we kind of need to then go, okay, good. Again, we go to a doctor and he tells us to get blood tests and all that. It could cost us $1,000 and we don't care. We just want the pain to go away. Right? Yeah. So this is what I said to you before, that I want you to elevate yourself. You're a heart doctor now. You're not a you're not a podiatrist. You're a heart doctor, because it's the same concern they're going to have. It's just a different anatomy. I want you to do that, because even kind of way you went said, well, yeah, but I'm a podiatrist and done. No, to me, if I got a foot, you're the man, right? If I got a sore foot like I have now, no one else can help me except you as a podiatrist.
Mm-hmm.
And I want you to feel that, I'm going to say this word, I want you to be the specialist that other podiatrists go to. I want you to think that way about yourself. That makes sense?
Mm-hmm.
I want to be I want you to be the specialist other podiatrists go to, meaning that everything you say is iconic up here, because that's really what your clients feel. So I want you to think about that. So because you don't do that without you realizing it, you don't, you are an empathetic, you're not, we just kind of, you do rush it. And I think the reason why you rush it is, I think there's a bit of a comfort zone, Donald, that you can, I'm going to do this or that, but chances are I'm not going to get the sale anyway. And so I think there's a little bit of a comfort zone why you're rushing to get to the end of it, right? So there's two things. There's comfort zone, you're trying to rush to get to the end of it, or you're trying to get to another patient. But that's the feeling that I'm getting, right? And I think I don't think that's your style, buddy, to kind of rush to get to the next patient. I don't think that is you at all. But
No,
I think you.
I have a high follow through, so I just want to I kind of know what the challenge for us, right? You come in, I know your problem. I know what to do to get you better. But it doesn't matter if I know if you don't understand I care, right? That's where I think
Bingo. Yeah, that's it, mate. That's it.
the
Exactly.
disconnect is like, okay, I see this 10 times today, Troy, you're just the 10th, and I still,
Yeah.
that's the challenge is, okay, gotta be, Troy has to tell me you know what I'm saying?
Yeah, yeah,
So
and this is the thing, and so this is a thing where it becomes automatic,
it
right?
becomes
It becomes
very repetitive. Like I've given this presentation many, many times. So,
yeah.
I and I like people. So I think would it even be, maybe I'll start trying it without the presentation because I did it for years
Oh
without it.
no, 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 your presentation is brilliant.
Helps.
Because you got, and this is something, when you got call centers, people say, "Oh, yeah, I'm doing something," and said, "Well," and they go, "Oh, I made a mistake." So, well, no one knows you're making a mistake because you're talking to a different person. They haven't heard it before. So, even though you've heard it, right? Even though
Troy, can I
you've
show you something else that I use here just to
yes, please, yeah,
get
sure,
your opinion here?
yep. Am I helping?
You very much so, and I just didn't have it.
Good.
No one else likes this stuff, so I'm glad you like this stuff to help me. The other thing I want to show, this is the other, and I don't know if this is too much, but I'm very logical when I
Sure. Yep.
explain things,
Yep.
and so this is what I give patients. So I'm kind of like the one I'm checking off in my pocket. I have it all kind of written out what they need to do. Is this too planned? Like this is what works. This is what will
Um,
get you better. And I check off what we're going to do. I don't do everything, but
yeah,
we're going to check
yeah,
off.
yeah, yeah. No. It's scary. This is scary in so many ways. One visit, because I'm looking at that X-ray evaluation. Yeah, this is scaring people away because it looks expensive. MRI, cortisone, that just looks like, hang on, it's going to cost me $5,000. When I look at it, I think, holy heck. And I'm going to go, oh, maybe I just see if my foot's going to get better on its own. That's what I would be thinking, right?
So
Yeah.
when I'm having you leave, how are you gonna remember everything? What you have to do?
Okay, right. So, yeah, okay. So, like, if you're going to go visit one, and I probably wouldn't call it visit one. You kind of go, come up with a name, consultant, our what do you call it? Immediate consultancy, or
Phase one or phase two? I don't know.
yeah, no, no, stay away from that because then phase one could, they could think they've got phases or 6 or 7 phases, right? Yeah.
Basic and advanced
Yeah,
or
so introductory
consultation.
consultation could be done, or something, whatever you're going to call the first one. Consultation, use the word consultation because that's what you're doing going forward. Don't have visit 2, visit 3. You don't need to do all that because what you're doing is you're saying, look, this is what my solution is going to be number one, number two, is this here going forward. But John, really, but this could just take care of the initial problem now. John, let me ask the question. How worried are you that this could come back? And so remember emotion. You've got to make them feel like, why do I kind of need, why do I need to do this? Right? Yeah. And this is the thing about people, they go, well, do I really kind of need this if I'm going to have the pain? And for me to invest 2,000, I've got to this really has to affect my life, right? Because $2,000 to some people, it's going to affect their life, right? To you, me, etc. 2 grand's not going to change anything in our life. But some people may not be that, right? Some people, that 2 grand could be, holy heck, that's 4 months away, whatever the case. So I think we've got to be mindful of that. Also, what we've got to be mindful of is that everything is free at the beginning. Insurance, insurance, insurance. So my perception would be, well, anything you want me to do is going to be covered under insurance. So then to say that, then say, but it's not. We have to put you have to take the first one and we have to put more work into the first one. We're not covering as much as we need to do. We don't want to tell them the price, but we kind of go, so John, what I'd like to do is see you again coming in, see how the treatment's going, because I've had some patients where, yeah, we fix it now, but you come back. So John, you're a runner. Have you ever sprained, you ever had muscle? Yeah, we had it, do you go to a chiropractor, John? Oh, I go to a chiropractor all the time. Right. Why? Well, I have a stiff neck all the time. Right. So we fix it, but then you come, oh, I've got to go back in another 3 weeks. Why? I can't go to the gym, can't lift weights going forward. Right. So now you're educating the client, right? You're educating your patient that he goes, oh yeah, I have to go back every couple of weeks, otherwise it just hurts. So if I can do that from that, and now I've got the injury in my foot, can you see how I can start getting that commonality going? Of yeah, well, yeah, and so John, and that's what my concern is because what a lot of patients do too. So John, if you don't mind me asking, do you really kind of want to deal with this now or for the future? And then we stop and pause and then we wait for their reaction to us, what they say. Donald, have you heard of Sun Tzu, The Art of War?
Mm-hmm.
Okay, right. So I do postings all the time, and I follow philosophy very, very in a lot of areas because it's very relatable to business advisory, and all that stuff. But one thing they say in that is that if you listen to your enemy long enough, they'll tell you how to defeat them, right? And so if you listen to your patient long enough, they're gonna tell you how you can sell to them, what they're gonna buy. So if they say, John, let me ask you, how bothering is this for you? That, oh, I haven't been able to go to gym, haven't been able to go to work, haven't been able to do this, right? So they've had a quality of quality of life has been affected so severely, then, well, I might have to pay the 2 grand. I might have to get the 600. I might have to do that so John, what I recommend and what for patients is, get a sole insert. Yeah. Now, you can get those cheap ones at the pharmacy, but this is not going to be the problem. This is the reason why, and then we're going to go into explain why the value of this amount. So we kind of set it up that way. And so no, we don't talk about price, we don't do any of that. Also, John, just to let you know, some of the recommendations too. It used to be, but now they're changing. It may not be covered under insurance. I have no say over that, right? But some things will be able to cover, some things may not be able to cover, and some of the things that I'm going to suggest for you, it's not going to be covered under insurance. So,
And the
but we'll
reason is
talk
because
about that later.
they speed up the recovery. That's the reason. It just
Yeah, but okay, so this is the thing. Speed up the recovery for how does that help me in my life? You understand? So that's got to be strong enough. So that's where we've got, and that's why I think and again, I haven't seen the second presentation, but just based on what I'm feeling, what you're telling me about clients, um, we're not building the value up. So two things based on what I can see happening. One, you haven't got the value up, and as I said, you're just dropping. Okay, you got to get 600 to get that as well, and it's like, what is that feeling, right? Why? And I'm going to give a classic, very quick example of that. My daughter, she turned 4 last week, and we went to the same doctor hospital again and again for 2 years. And that they kept saying one thing to me. They were like, "Oh, we want this," and then they went, she needs this, 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 this." And I said, "Oh, okay, right, we're done." And then they said, "Yeah, it's going to be 1,000 or 2,000 or something." And it wasn't the money so much; it was how they told me. And I was like, "What? You never mentioned this before to me. Now you're telling me, everything is good, but now you want me to invest." Well, yeah, you don't have to do it if you don't want to. But I suggest that your daughter do this, this. And then it was like, so you're trying to make, without her realizing it, and she didn't do it deliberately. They don't have the skills, right? But it was like, I said to my wife, I said, I feel like I'm just being scammed. We're probably not, but I feel like I'm being scammed, right? And my wife said, yeah, I do it too. And guess what? Because she did it that way, we went to another hospital and been going there ever since. And the interesting thing, the other hospital is double the price of this one here. You understand what I mean, right? Just because I got that feeling, I went to another hospital, we're paying double the price, but I don't feel scammed in any way. It's just what it is to go to this better hospital and doctor. So it's not the price, it's just my emotional feeling of what it was done. And I feel that is something what you may not be aware of, but your client might be feeling when you go and drop on $600 or something like that. Right. And so, yeah, and so you probably think, well, Troy, how can we fix it? We got to put some time into the first one, the second one, because every time you meet someone now, right? Yep, it's cost you every client's worth, and I'm sure you got probably you probably got 60% off whatever the amount profitability. So effectively, every time you meet with a client, you're making probably anywhere from $1,000 or some profit. Again, doesn't matter what it is, but you can see where I'm going with it. And that's what we need to put the time in. And so you don't want to rush it. If you spend half an hour with someone and you get the deal, guess what? You do 3 or 4 a day, there's $3,000 or $4,000 you're making just in with this new product. Can I ask you a question, Donald? I know we're going to be running out of time soon, but let's go another 5 minutes over if you don't mind. Um, um, what is your closing rate? How many clients do you get, and then you're not closing them?
So there's two things that I close. I feel like so the first aspect is the Shockwave. So I traditionally have been done 3 sessions of Shockwave, which is 750. What sells at 100% of the time is the ultrasound. So the ultrasound, I show them the thickness, I show them 1 foot to the other foot, and then they are able to understand how the Shockwave reduces that thickness. So
Sure. Yeah.
I'm actually going from 3 sessions to 6 sessions because 6 works better, and no one ever says no to me. That's why I'm going from 3 to 6. Okay, and it works
Okay. Yeah.
better. Hmm?
Yeah. You mean 3 sessions for the shockwave?
Yeah, I've been traditionally offering 3 sessions, then a 6 week follow-up. I'm now doing 6 because no one was saying no to me at 3. I'm just and so whenever
Yeah.
either my
Okay.
price
Yep.
is too little,
Yep.
right? If no one
Yep.
says no, then the price is too little. Either
Yep.
increase the price or increase the amount of treatments. And what I think would really benefit the patients is doing more treatments because a large majority, I do 3 sessions, 6 week break, and then I do another 3. So it's delaying things by 6 weeks. So that's the first thing. For the
Okay. Yep.
orthotics, I bet you my close rate maybe is 1 in 5. Um,
Okay. So
and just let me share one thing. One thing about my
yeah.
partner, who does a lot more than me, and I don't know how to, because we have different personalities, but he is always about an hour behind. But he is so over the top in terms of explaining and wowing the patients.
Okay.
And it's
Yeah.
not has I don't even think he mentions orthotics. It's just the aura. I don't know if you know what I'm saying.
Yep. Sure.
And
Sure.
and
Sure.
there's
Yeah.
different personalities of doing that, but that's what, and it could be because it takes, a month to see him and things like that. It could be the positioning that way where it's hard to get in and
Yeah,
and the
yeah,
time he spends. And I just
yeah.
I feel like I don't know if I have enough stuff to talk about for that long. You know what I'm saying?
Okay, sure. Okay,
I'm
so
just
a
sharing
couple
what
of things.
my feelings are. I just haven't been
Oh,
able to
no,
talk
okay,
about
right.
this.
Okay, so first of all, okay, so you got about 20% closing rate, right? 20%. Okay. Now, no matter what product it is, when people first come to me, they're going at 15, 20% anyway. So, look, we're going to be able to immediately increase that substantially. I say to clients, within you know, within 1 month, we're definitely going to be able to get that probably up to, with your product, the way we're going to be able to do it, we'll probably get to 60% conversion rate. I can't see any reason why. Look, you're a likable guy, Donald. There's nothing not likable about you. One thing I like your energy, and when you talk to, when you're doing your role play, what you did to me, I felt like you really cared, and that excitement was, we can fix you, we can fix you. Right. And that's kind of what I think you're giving. I have no idea what your partner does because I've never met him, right? If I met with him, of course, I'd kind of be able to tell you what. Yeah, I could meet him probably 10 minutes. I could probably tell you why he's got that close rate going forward, and why he has that, right? Um, so yeah, there's two very obvious things I think what's being done. So I want you to think about something. You're already at 20%, and straight away there's two big red flags that come up. One, people are going to feel like, yeah, you're rushing it going forward. But this is, I think, what's a good thing about 20% with, and is this new business? We're talking about new business, right?
So
Where you current
these
clients?
are so a lot of times if I find that if I repeat it over and over, like my closing at the second visit is probably about 20% at the second visit. And then later down the road, let's say they come back after 6 weeks and they're still having some pain, then I'll offer it again, and then there'll be other takers. You know what I'm saying? Different.
Yeah.
I'm saying second
Okay.
visit. Then down the road, I tend to find the more I recommend it, the more people take it. But I don't feel like,
Sure.
I yeah, I'm not sure why.
Okay, right. So first of all, your second visit should never be at 20%, ever. Because the reason being is you've already got the trust and confidence into them. And so straight away by us
It might be asking too much
increasing,
too quick.
no, no,
Is
I'm
that
not
what
going
you
to say.
meant by the
No,
second
no,
visit?
no, no. The reason why, look, you're 20, your second visit, you don't have to build rapport. They already trust you. You got the authority already. So they're coming back. The reason why it's 20% is they're getting shocked by the price. You're just lobbing the price onto them straight away. You're not closing them. And again, I don't know what your closing skills are and your handling objectives. We haven't covered that. But just straight off the cuff, the reason why, 20%, no, we'll immediately get that. People coming in second, we're going to get that to 45, within a week or two, we're going to get that to 45. And that's just by positioning it correctly. And the way you're doing it is, people are not expecting $600 or $1,500. They're just not expecting that. And so, and why you're getting 20% is, you're already proving that you're the authoritative element already. So you're already doing that. So the people coming in already like you, and I would imagine it's a pretty easy sell. So you're having two things. You've got, oh yeah, they're buying it easily, and then you got the pushback. Is that correct?
Yeah, then the ones that say, let's try the other stuff first.
Yeah. Okay. Right. So that's what I mean, right? So, even when you do a second interview, so a second meeting with it, you've set it up in the first one, and second one you're going through. Somebody might now take to a third one. Your product, we don't need to do that. But
No, but then I see them three every week for the next 3 weeks when I'm doing the shockwaves on them. I'm doing those treatments.
yeah, but the Shockwave only comes in if they pay the 750, right? What
It
is
is
your conversion rate on your Shockwave? Is it
pretty much
20% as well?
100%, 80 to 90% of the shockwave.
So you're telling me, so you're okay, so you're okay, okay. Well, so you're telling me in the second meeting they're paying upfront 750.
And it's because of the ultrasound. It's the dynamic demonstration. I show them their fascia is thickened on one
Right.
side than the other,
Sure. How
and they
much is the
understand.
ultrasound?
Huh?
How much is the ultrasound?
$100.
Okay, 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 okay. I'm glad we got that one done. Okay, right. Okay. So this is the thing, right? Okay, so if you're getting 100% going, so you're saying they're doing the shockwave, they're doing the ultrasound, you're saying 90% of the people come in the second meeting, right?
Are
You're
scheduling the three shockwaves.
so are they scheduling that in the first meeting or the
The
second
second
meeting?
meeting. The second meeting is where they say, okay, let's schedule. Actually, they're doing one at the second. The second meeting, I do the ultrasound, do first shockwave
Yeah.
if it's
Yep.
indicated, and schedule
Yep.
another two just to utilize
Okay,
my
right.
time.
Okay, right. Okay, which again, why I said the second should never be at 20. It should be at 75% easily going forward, right? Yeah.
Yeah.
So they're doing the ultrasound, they pay $100, of course they would do that. They do the shockwave, then you tell them, they say ultrasound, this is what all the problems are going forward, right? And of course that's why they're doing the ultrasound succession. So yeah, so six, what's that? So okay, so $90 a session. Again, people are going to do that because they're doing it. So when you do the shockwave, how are we not getting? What happens then? You tell them about the orthotics.
So the
What happens then?
shock the when I introduce the orthotics, I do it usually based on foot position, right? If their foot is very pronated, I might offer it the first visit if they have a foot type. But I explain that what the research shows is you need a high contouring orthotic, and I take an over the counter one and I show that it doesn't contour. In the custom one, it contours high to the arch to reduce the strain on the fascia so that it can recover. That's one of the reasons is plantar fasciitis, but it can offload other areas as well.
Okay,
But I
okay,
explain that, but I'm not usually explaining it the second visit. I'm just
right,
that's where
okay,
I don't have
okay.
a great method of like, do I offer it every single time?
Yeah,
I think everyone would benefit from it. If insurance covered it and it was free, everyone would get them because I think they
yeah. Well,
benefit people.
yeah. Okay.
But
But I guess where I want to know is because I'm putting the pieces together and some parts are not adding up. And this bit here.
okay,
So they're paying $750. They do the shockwave, right? Is it after that you recommend the orthotics or what?
not usually.
Majority?
If people could do everything, I would have them do everything. The shockwave and the orthotics.
So they have a choice, the shockwave or the orthotics.
If I would pick one as a patient, the shockwave works better to get rid of their pain. The orthotics does better to help the pain from coming back.
Okay, right. Okay, yeah, that's what I thought. So the ultrasound is, oh,
Well,
John, you got this problem here.
orthotics don't resolve heel pain.
No, I get no, the orthotics is so it takes the pressure off you when you're walking and stuff, so you don't have to come
It
back,
takes the
correct?
strain off the fascia, so it helps it. I think it helps
Yeah.
recover a little bit better, but then mostly it helps so it doesn't come back.
Okay, I'm going to ask you an honest and direct. No, we're going to go. I'm going to ask you an honest, direct question. What, and I want to know this for a reason, right? What do you pay for the orthotic?
$90,
Right. Okay,
90 to 100.
that's what people are thinking already, right? They're thinking that. That's why I want you to do it. I'm glad you asked it. So they're thinking, hang on, why is he making so much money? Again,
But
again,
then I
I've never seen
explain
orthotic.
it's kind of like then I use the example. It's kind of like the difference between buying over-the-counter reading glasses that
Yeah,
help
yeah,
correct the mechanical instability in your eye as something
yeah.
in your foot. So like a
Right.
actual prescription, it's going to be more
Sure.
expensive because it's made
No,
specific.
exactly. Yeah. Yeah. Same with the mouth guards, like different between this one, this one. Okay, so effectively we've got to make a gap of $500. What can someone buy the orthotic in a chemist or pharmacy, and how much are they going to pay?
60 and it lasts about 6 months, whereas ours last about 5 years.
Yeah. Okay. Right. Okay. So this. Yeah. Okay. Um, so I'll give you an example of that mouth guard. We generated 4 times within a 3 month period taken from changing the thought process. And the reason why I'm doing that, and I'm relating that to you, because it was like how they could go into a pharmacy and get something substantially less instead of paying $1,000, substantially less for something. And it was like, how do we show that value? And so I can go into it and pay $60 instead of 600. So I can pay 10% of something, right? And I'm buying it over the counter and it's going to last me 6 months. Or I buy yours. So we need to show, and this, so again, we need to show the value, but the value is going to be replaced by, okay, you just paid $750 because you had a problem. Let's say they don't get the orthotics. How easily could the problem come back?
I don't know for sure. Not because not
Now, I
everyone
know
gets
you
the
can't over
orthotics.
one, but
So
just
the amount of patients I heal from Shockwave and with plantar fasciitis, maybe 5% will come back with it. But orthotics
okay.
aren't just to reduce the pain of it coming back. People feel better about them. It helps their back. It helps other things as well.
Yeah, okay, right. So, yeah, we just got to create, yeah, we have to set it up in meeting one,
Yeah.
right? Where you're losing it is showing the shockwave and author, and I think you're doing it as two separate. We don't have time to do it now, but I want to see how you present that because that's why you're losing. We're not presenting the shockwave in a correct manner, which is really like we kind of have to do that. It's like yeah, I know you probably don't want to pay for an MRI, but guess what? We
Hmm.
don't know what this is, and I kind of want to get a better idea what that is. You
Okay. Thank you.
okay? Does that make sense, right? You kind of say, "Oh no, yeah, I don't think I want to MRI. I just get an X-ray." I say, "Yeah, but X-ray can't show us if there's something under here that we're not
That's why we
sure
have to
of."
look at the soft tissue. Yeah, with the
Yeah,
ultrasound.
right. So, and so I may not want to pay the money, but hey, I want it. The X-ray may come back, and I still may have the pain and what's causing it. So I'm more inclined that I have to have it, even though I don't want it, right? And so this gets back to, yeah, people. If I asked you, have you ever bought something you don't want? Yes or no?
Yeah.
Yeah. Have you ever
No,
bought
everything I
something?
don't want. I guess I may have. Not often.
Yeah. Right. Okay. Sorry. Let me rephrase it. I don't want to rush to no, I'm running out of time, but have you bought something you need but you don't want?
Hmm.
Yeah. Have you bought something you want but you don't need?
Yes.
Right. That's your client. That's your patient. I don't need it. I don't want it, but I kind of need it. And it's just a matter of positioning it that way. I'll give you a classic example. I said, John, based on what we have now and where the MRI, ultrasound, I want to bring two things which are concerning for me. And this is what I found with other patients. One, I want to suggest a thing called shockwave. And what that's going to do, it's going to do this. Now, what it's going to do, it's going to make your foot feel so much better and it's going to be able to again make you be able to walk and not go through that pain. How many days did you tell me that you had off? 2 weeks, 3 weeks, you can't run? We're going to be able to deal with that now. But this is the thing what people don't realize. John, I want to give you an example. Has a doctor ever told you to take antibiotics, right? And you take them, right? And he says, and the doctor will say two things. Whatever you do, take the full prescription for two
Yep.
weeks, right? And what do? We take it, we feel great. And after 1 week, we go, hey, I feel great. What do? We stop taking the antibiotics, correct? Yep. The doctor said take the antibiotics for the whole period because that's the reason. So what happens is we feel great, but then what happens? You ever got sick again? Now we go back to the doctor and he says, did you take? So you go and you feel guilty, right? You say, no, I didn't. He says, right. So what's happened now? Your body has got an immune system to the antibiotic. We're going to give you something stronger now, right? Yeah. We learn from that mistake. I want to bring this to your attention now. We just don't focus on where we are now. We need to focus on the future because this is what can happen. We want to support the foot going forward. And what I'm going to suggest for you is what we call orthotics. And what that actually does, it's going to be something you're going to put in each one of your shoes, right? And you're going to give you the stability to make sure you don't have the problem again. So now I'm going to be right up front with you. Yeah, there's a bit of an investment going forward, but if you compare that to the problem you had, and you're not being able to run and coming in. And also, I don't want you to come in a couple of months' time, and we have to then go through the whole shockwave element again. We don't want to do that. So, John, we want to focus our attention on fixing the problem now, but also want to prevent that. And where patients, when they get the orthotics, they don't have problems again for years. And that's kind of where we are. Does that make sense, John? Right? We'll stop role playing. You see what I'm able to do, Donald? Right?
You
I've really
want a
got you.
job? I'll give you a job. You can come see.
I'd like a dollar if everybody said, "Hey, Troy, could you do me a favor? Jump on a plane, fly to America. Let's do it. Let's get sit
We'll,
down,
we'll,
my chick.
we'll we'll set
Yeah,
up another one, Troy. This was helpful, so thank you.
that'll be great, mate. Okay, I'll deliver now. I'll send you. Can you do me a favor, Donald? So we'll do the payment that through Fiverr, but let you and I talk through WhatsApp. Are
That's
you have
fine.
WhatsApp?
Yeah, here, let me give you my phone here.
Oh no, just do it. Make it easier. Are you at my? Go to my website, in
Uh-huh.
your phone, troy@ratliffcoaching.com,
Okay.
and then just send me a message straight away in that. You're
Okay.
going to link.
I'll
Can
send
we
it
do
through
that now
WhatsApp.
before you go, please? Is that possible?
I'll send it through
So,
WhatsApp. Okay.
okay, that'd be great. Okay, Donald, good talking to you. I'm glad I
That was,
helped you. How about we do the same time, same next Thursday, okay?
yeah, that's fine. Good.
Good. Okay, mate. Have a good one.
Bye.
Cheers. Bye bye.